Good day, everybody. I am Professor Dr. B.K.C. Mohan Prasad, Chairman Mohan's Medicity Hospital speaking. God has given 10 commandments written in 2 stones for the benefits of the human population to his disciple Moses in Mount Sinai. So like that, we have got 10 commandments for each cancer. I would like to elaborate 10 commandments for the various types of cancer. Let us see the 10 commandments in colorectal cancer today. Colorectal cancer is the commonest cancer in the entire Western countries and developed countries. Why it is so common? This is because of the food habits. They contain lot of fat containing food, less fiber, so they are mostly constipated. So less fiber, more fat, colorectal cancer. That is the order of the day. Can colorectal cancer, what are the symptoms? Mainly the patients presents with right-sided colonic cancers, they present with unexplained anemia and bleeding per rectum and inadequate bowel emptying. They will go to the toilet, they will come back, once again they feel like going to the toilet again. So inadequate bowel emptying and bleeding per rectum, these are the commonest symptoms. Colorectal cancer also runs in families. That is very important. Colorectal cancer, 10% of the colonic cancers are heredofamilial cancers. And most important, why people are afraid of colorectal cancers, especially rectal cancers, because they do surgery and they keep a stoma, that is the permanent opening in the abdomen to pass motion. So people are afraid of stoma. That is why people are afraid of colorectal cancers and the treatment. But what is important today, beware that colorectal cancers can be cured without stoma. That is the message of the day. We have got ultra-modern radiotherapy and chemotherapy facilities. Thereby, we almost melt the colorectal cancers to a maximum extent of 90%. Only 10% of the families and patients require treatment, that is surgical treatment after that. And that too, stoma can be totally avoided with the usage of staplers and the minimal access surgery. So colorectal patients, the stoma is almost a forgotten type of treatment today. And a treatment of colorectal cancer with radiotherapy, chemotherapy followed by surgery is possible, and that can be done without a stoma, especially using the staplers and the minimal access surgery technique. Then colorectal patients can be easily avoided by a high fiber, low fat diet. We used to tell the patients, you reverse your plate of food. That is, keep the vegetables, fruits, fiber diet, etc. bulky, keep rice and dal and the wheat everything very little on the other side of the plate. So if you reverse your table, that is your plate, and consume lot of fibers and low fat, colorectal cancers can be easily avoided. And for high risk patients, people who have undergone a family history of colonic cancers and they got incident of colonic cancer family, an annual colonoscopy. Annual colonoscopy is a very simple procedure where we introduce a camera along the anus and do the examination of the colon. Sometimes people may be afraid of colonoscopy. I don't want any scope to be introduced into my anus. Then no problem. We have got a virtual colonoscopy which can be done with any good MRI center. So a virtual colonoscopy is as good as a colonoscopy, but only thing, in virtual colonoscopy we cannot take a biopsy if there is a suspicious lesion. And we got a blood estimation called serum CEA estimation. An annual periodical estimation of the blood test will almost, if it is normal, you can be pretty well sure that you may not suffer from any major colonic or intestinal cancers. So colorectal cancers can be treated without a stoma. Colorectal cancers can be easily avoided by a high fiber and low fat diet. And annual colonoscopy is very, very useful in screening colorectal families. And colorectal cancers can also be preventable cancers, though its incidence is increasing in the Western countries. Thank you.